Welcome back. There's a major change coming to public hospitals. New staffing levels mean there has to be at least one nurse for every 4 patients.
The government is now on a hiring blitz costing taxpayers $1 billion, and it couldn't have come at a worse time for the budget.
On the ward at Liverpool Hospital,
one of the busiest hospitals in the country,
the Premier arrives with a promise more help is on the way, beginning the next phase of minimum staffing levels of 1 nurse to 4 patients across all medical, surgical and specialty wards in the state's 228 hospitals.
Access to timely care, safety and quality of care and stopping burnout.
The ratio policy will cost more than $1 billion, with an extra 2,500 full-time nurses needed.
We don't expect the reform to be easy. We will need to recruit more nurses. We will need to retain experienced nurses in the system.
But the unions warn go without, and it will cost patients.
When you introduce 1 to 4 on the wards, what you see is a decrease in the adverse outcomes for patients.
But as the government backs nurses, it's Daniel Mookie's budget that's on life support, with the state's economic growth expected to be significantly lower than first predicted, teetering on the edge of recession. The Iran war being blamed for growth forecasts falling from 2.5% to 1%, with 3 consecutive interest rate rises hitting the Treasurer's wallet as well as family budgets.
Stamp duty collections are likely down by $5 billion over the forward estimates.
The government got their numbers wrong and now they're using Iran as an excuse.
Taylor Aiken, 7 News.